So at the outset, is private practice for me, business ownership, wearing those hats, doing a lot of the things ourselves. And then from there, there's very often times that question, should I expand?
This episode is sponsored by Therapy Notes, therapynotes.com. Be sure and check them out, and be sure and use the promo code Gordon, Gordon, and you can try them out for 2 months for free. Over 15 years ago, when I started my private practice, I had to learn a lot, and most of it the hard way, and I don't think you need to do the same. Hi, I'm Gordon Brewer, a licensed psychotherapist, and welcome to the Practice of Therapy podcast, part of the Psychcraft network of podcasts. Join me in this journey of discovery as we have conversations with other leaders and professionals in both the mental and allied health fields. Join us as we explore both the business and clinical sides of running a private practice. Welcome to the podcast. I'm Gordon, and this is episode number 305 of the Practice of Therapy podcast. Looking forward to you getting to hear from Julia Nepini today. Julia is just a delightful person. I got to spend some time with her in person back in October at the Wise Practice Summit in Savannah, Georgia. But she is just so enthusiastic and so fun to get to know. And today we're going to be talking about team building and just about how you want to think about, adding to your staff and what kind of culture you want to keep in your practice, particularly for those of us that are in group practice. I think that's a really important thing to understand, and just how to hire the right people and what to look for, and just thinking about your own values. So it's a really rich conversation that we have, and looking forward to you hearing from Julia. Before we get there, though, I'd love for you to check out a couple of things. One is I'd love for you to go over to practiceoftherapy.com/mentalhealthware. As I've mentioned in previous episodes, my good friend Ashley has put together an online store where she's selling custom printable items, things like t-shirts, sweatshirts, clothing, accessories, that kind of thing. But if you're looking for some ideas for gifts for your staff, go check it out. They can, she can customize most anything, put people's names on things and all of that sort of thing. So be sure and check it out. practiceoftherapy.com/mentalhealthware. And I have committed to helping her with this, been helping her with the website and getting this venture up. So I'm going to just shamelessly give her a plug here on the podcast because I can. And also before we get to my conversation with Julia, got an upcoming episode with Morgan Zients from JotForm. And if you're not familiar with JotForm, you can check it out by going to practiceoftherapy.com/JotForm. And it is a cool platform that I've been using a lot more here lately, where you can create just about any kind of form you can think of. And also they have a plan where you can get it and make it HIPAA compliant. And so go and check it out. Just go to practiceoftherapy.com/JotForm and you'll get kind of ahead of the game here with that upcoming episode. So again, practiceoftherapy.com/JotForm. And also, real quickly here, before we get to my conversation with Julia, I'd love for you to hear from one of the members of the Psychcraft network, along with a word from our sponsor, Therapy Notes.
Hey there. If we haven't met, my name is Lisa Mustard, and I'm the person behind the scenes of The Therapy Show with Lisa Mustard, a podcast where I interview seasoned and knowledgeable talk therapists from the counseling world to glean valuable insights, techniques, and tools that you can apply to your practice and your life. Plus, you can also earn continuing education contact hours from some of my episodes. So to learn more about the show and get your first continuing education contact Hour for free, head on over to my site, lisamustard.com.
Have you ever wished your private practice could run as smoothly as a well-oiled machine? Well, look no further, because Therapy Notes is here to revolutionize your practice. Therapy Notes is the complete practice management system you've been dreaming of. With everything you need to manage patient records, schedule appointments, meet with clients remotely, create rich documentation, and handle insurance billing, it's your secret weapon for a smoother practice. And the best part? It's accessible wherever and whenever you need it. Yep, even on the go. Imagine having more time for what truly matters, your clients. It's like having an extra set of hands, but digital. And here's the kicker. It's the very EHR Gordon relies on in his own practice. So, you know it's the real deal. Say goodbye to paperwork nightmares and hello to more time and better quality care. Check out Therapy Notes today at practiceoftherapy.com/therapynotes. Oh, and don't forget to use the promo code GORDON to get 2 months free. That's practiceoftherapy.com/therapynotes with the promo code GORDON. Enjoy the show.
Well, hello, everyone, and welcome again to the podcast. And I'm really looking forward to you hearing from Julia Nepini. Welcome, Julia.
Thank you so much for having me, Gordon. I am equally excited to be here with you.
Yes, and Julia and I got to be together in person at the Wise Practice Conference back in October. Yeah, and in beautiful Savannah, and so it was a great conference and really got to meet a lot of great people. So, but Julia, as I start with everyone, why don't you tell folks a little more about yourself and how you've landed where you've landed?
Sure. I am a licensed independent clinical social worker. My practice is in southeastern Massachusetts. We are an insurance-based practice of 20 clinicians called Compassionate Counseling Company, and we really serve the whole family, individual couples, family therapy, as well as groups. And it's a great team. I am very proud of them. And I also do private practice consulting. So I help clinicians start, expand, and diversify their practices. I was doing that unofficially for all of my colleagues, and it ended up making so much sense to just do that officially. And I love it. It is some of the most rewarding work I have ever done. And then I have a podcast called The Compassionate Climb, where we discuss the challenges of being successful in business while maintaining integrity. It's not as easy as it sounds. So that's been a fun journey as well.
Oh, that's awesome. And I think your journey kind of parallels mine as far as the consulting piece, because same thing, people started asking me and that sort of thing. So I decided to put my shingle out on that end, that business there. But I know one of the, why not? I mean, it's, So Julia, I know one of the things that's really important to you and important to me as well is just thinking about how we build, particularly for those of us in group practices, how do we build a culture that is going to be fun for people to be in, but also something that's sustainable?
Absolutely.
Yeah.
Yeah, this is a great topic because it's happened in stages for me. And I think it's so important for people to really give this some thought. So at the outset, is private practice for me, business ownership, wearing those hats, doing a lot of the things ourselves. And then from there, there's very often times that question, should I expand? If we're lucky, we get full very fast. It can be hard to say no. And we only have so many clients that we can see. And so we hit this glass ceiling and have to decide kind of where that cap is and how we want to be spending our time. And so for me, that was group. I had worked at a group practice. I had worked in community mental health, and private practice was very lonely. And I missed the team environment from the hospital that I had worked in and the team from community mental health and that consultation and collaboration. And so I made the decision that I was going to expand, but I did this very conscientiously. And I wanted to do everything in my power to ensure that if I was going to expand, I was going to create the type of environment I would want to work for. and that
Mm-hmm.
I was going to be able to provide a lot of the things that was lacking in a lot of places that I had worked previously. And so at this point, reflecting back, I can confidently say that I have done that. It has not been without challenge, trial and error, and it
Mm-hmm.
has definitely been a journey for me personally in terms of really opening me up and identifying clearly my strengths and the things that I can improve on. But it's been one of the most rewarding things I've ever done.
Yeah. And that's, I think that's true for a lot of us that go into start group practices. We want to create the kind of place that we didn't have when we were maybe it's interesting. Most of us in private practice have also worked in agencies, and
Okay.
you learn very quickly that just, I think for a lot of people is just not sustainable and that sort of thing. So, yeah. So I'm curious, what was the culture that you were looking for that you couldn't find, and what
Mm-hmm.
is that for you now?
Yeah. So one distinction I think is important for everyone to make when they are expanding. Do you want the type of practice where people are going to come in, do phenomenal work, and then they leave at the end of the day and that's that? Or do you want to intentionally create a culture where it goes beyond just the work, that you also have opportunities to collaborate beyond that? And it was very intentional that I wanted the latter. And I
Mm-hmm.
recognize that it's so important to maintain professionalism. But for me, I wanted to view my employees and my team members as just that. They are people. They are obviously clinicians, but they are also unique in their personalities and their previous experiences and what they bring to the table. So when I hired, we kind of did it in clusters. And so it was to really try to meet the needs of the community, the number of referrals that were coming in, the issues that the majority of clients were coming to us with. And so a lot of it came in time. It wasn't necessarily a pre-planned thing. I knew that there were certain things that I needed to have, systems that I could replicate, meetings, touch points, but we've added in a lot of extra things as time has gone on because of feedback that we've received from the team members themselves through our interview process, learning from our peers. And so I guess I can kind of go into that. So I always
Sure.
wanted to have some level of connection with the team. I want it to be accessible and available. And so at a minimum, I meet with every team member at a minimum of once a month. Mm-hmm. And so that is an opportunity to discuss the big picture, but also how they're doing. And so I created a survey that kind of goes along with that I administer to everyone. And it's a clinician engagement survey. And so we go into not only what has their experience been in the practice and why did they decide to work here as opposed to somewhere else, because I recognize they can go into practice on their own, they can work other places. Why here? And then in addition to that, it's what are their long-term professional goals and how can we help them achieve that? What is their typical level of stress in any given week and the main source of that stress? Rating their work-life balance and things that we can do to assist with that balance. And then rating the quality, I guess, or areas that we can improve when it comes to the team meetings. Do they find them helpful and how we can improve that? We do peer consultation groups. So biweekly, we have divided the practice in half because we've grown so big. And so they rotate and they present cases and somebody will take notes. And so it's a great opportunity to present cases. We discuss challenging cases and share resources, but we always make it a point to talk about wins. Client wins, professional wins, personal wins. And then it's just evolved from there. We do a lot of community service. So we're very involved in the community. We've done fundraising events. We have collected donations around the holidays. And then we have done gathering. So we always do a fall gathering where partners and kids are welcome. People have brought their pets. We always do a holiday party. And then we've also done some fun team building things like escape rooms and paint nights. And so it's not a requirement to participate, but everyone is encouraged. And I really feel like it's enhanced the relationships.
Right. Yeah. So what have you learned so far about why people want to work at one place as opposed opposed to another?
Great question. Most people have experienced what I have. They are either not interested in the business side, and solo practice is really not for them because they recognize that it would be isolating. Or they've had an experience in community mental health where they didn't like the fact that they didn't have flexibility in their schedule. They didn't have a lot of say in terms of the clients that they were seeing. And they didn't like that pressure of certain numbers that needed to be hit. And then when it comes to maybe other group practices, there weren't as many touch points and opportunities and the culture, that positive work environment that went beyond just everybody working collectively, but maybe beyond just the therapy room.
Right, right. Yeah, and what's interesting about what you said with all of that, you never said anything about what people get paid.
Yeah.
And I think that's significant. And you want to say some more about that?
Yes. So I am not someone who is inherently financially motivated. I recognize that money is important. I know that it's a necessity, and I recognize that there is value. However, it is not something that is a driving force. And so for me, I definitely wanted to ensure that I paid my team well. I am actually someone who will own that I made the mistake of paying everyone too well in the beginning, and I had to have that dreaded conversation. Unfortunately, my projections were off, and this is the state of the business. And if we keep going this way, it's not going to look good.
Right.
And I had to scale back. And I am grateful to say we lost one clinician whose plan was solo practice. It just expedited that process for her, which is understandable. Everybody else stayed and is still with us today. And we've obviously grown exponentially from there. So that was a huge lesson for me. But I think the piece that you're talking about is I had to get so clear about all the things that I was offering by being a part of this team that went beyond just the clinical hour. And all the things that I'm speaking to really seem to matter to the people that have found us and come on board and stayed.
Right, right. Yeah, it's interesting. Same exact thing for me when I first started my group practice. I started them as contractors, and I, not knowing my numbers, and I just picked a figure and said, oh, well, I'll give them this percentage. Big mistake. And I had to do the same thing, those hard conversations, about, okay, this isn't sustainable. So we're going to have to regroup. But it was the best decision I may have ever made. And it also, like you said, Julia, it really changed the whole culture of our workplace and the people that are on board. And
sharing that, because
it
can feel so isolating and like you're on your own island when it happens. And we can be our own worst critics. And these are hard conversations to have. So I'm grateful I'm not alone, but I also feel for you during that time. And I'm glad that you rebounded as successfully as you did.
And that was, so I learned a lot from that. And I guess when I asked that question or made that point about the money, I think what is significant to me is people do not work for money. They work for meaning and purpose. And and I think that's what's got to be in the forefront when you think about hiring people, and also just thinking about why people want to come to us as a private practices or group practices. But also, money is important, and people do need to be paid fairly and that sort of thing. And that's exactly, but the big thing is that they are really, like you've figured out, is they are looking for an environment and a place that they can find meaning and feel like what they're doing is making a difference.
I couldn't agree with you more. And the beauty of it is that when someone commits to your practice and they are aligned with the mission and your value system, and there is that transparency and the open communication, they are incentivized as time goes on for the great work that they're doing. And it's so incredible to be in this position now. So I hired my first employee May 2021. We're recording in October 2023. So in a very short time, we've grown so much. And to be in a position now where not only are we offering medical, dental, and vision and paid time off and reimbursement for CEs, we provide a lot of in-house trainings now. We're going to be adding a retirement plan at the end of the year and paid holidays. And it just grows. There's just more that we can do to reinvest in the business and the team. And if people buy in for more than just that initial rate that is listed in your job post, there's a potential for so much more.
Right.
So that's been my experience so far.
Yeah.
But it's taken time to get here.
Right. Yeah. So I was just thinking too about when we think about the culture of our practices, what have you found how in interviewing people and finding the right people, what have you found has been an important piece for you with that process?
The Enneagram.
Okay.
So
all right.
I have
Good.
found that to be an invaluable tool. So I don't introduce that until somebody has already come on board. But to introduce that once they have, it expedites the process of getting to know one another. It helps shift my approach in working with them. I have multiple clinicians that are similar numbers and finding those connections, and they go to each other for support around things because they know who is going to get it and shares the same motivations and fears. And I can also say that it's helped me to incentivize good work because someone who's an Enneagram 3 achiever is going to be very different than an Enneagram 8, let's say the challenger, in terms of what is it that's going to make them feel that they are acknowledged and appreciated? And for some, it is financial or like the tangible fruits of their labor. For others, it's going to be more verbal. And, a 2 is going to want appreciation and acknowledgement and thank you so much. It has just been so transformative. So that's one big piece. But I would also say really understanding the person in context. So what is it that they are specifically looking for? Can we meet that? And maintaining the work-life balance conversation throughout. It starts with their schedule and it starts with the types of clients they want to see. And then as they change and evolve, and if they're with us for a period of time, they're going to go through different phases, that we can continue those touch points and not only verbally having a conversation and meeting, but opportunities for them to put that in writing. So when we do our performance reviews, I obviously provide that for them, but they get to rate and review themselves and they get to rate and review me or whoever their supervisor is. So it's always reciprocal. And when I have asked them how they feel, it's supported and understood and valued. And that's really important to me.
Yeah, it is. It is. So it with your growth, that's another thing is that being able to have the right systems and processes in place to support that growth. You want to say some things about that?
Yeah, it's important. One of many, not one, the best thing that I did was pick a solid electronic health record and phone, text, and fax and encrypted email and all of those things that could grow with us. But then it's also been staying fluid with policies and protocols. So did I have my employee manual complete when I hired my first clinician? No, but I did have a template and I continue to add to it. And it is a fluid document that is ever changing and evolving, but we are all collaborative in contributing to that. And when we have a situation that comes up, we come together, we handle it, and then we come together as a team. And what can we learn from this? And is this something that should be in the policy? So I think that is so important, but I don't want that to discourage people if they really feel like expansion is right for them. There are several things that you should have in place, and there are other things that can come in time.
Yeah, what are some other things that you can think of besides, electronic health record system, that kind of thing? What are other things that come to mind?
I think the structure. So the organizational structure, that is a piece that is going to come with time as you hire more people and depending on their licensure level and the populations that they serve and how much support they feel that they need. hiring for leadership positions and adjusting titles. I also think the other piece is, and the Enneagram has helped with this too, identifying people's strengths and capitalizing on it, and then knowing what their goals are for professional development. And are those things we can offer within their time with the practice? So that's another piece that's come in time, is regularly checking in around those things, providing those opportunities, seeing it through.
Yeah. And then there's the whole marketing piece of being able to fill up their.
So I would say that has never been an issue for us, but it is primarily because we are an insurance-based practice. And I would say I came from a hospital that is in the same city that our practice is located. And I had worked there for 8 years, and I had formed relationships with the doctors and the psychiatrists and the nurses. And so that really helped to fill my practice. And then it just grew from there in terms of community and reputation. That is an additional challenge for a private pay practice, for sure. But I think that's really been a saving grace for us. So not to say that marketing is still not important. So we have a mailing list for referral sources. We have a mailing list for clients where we're providing practice updates, but also some valuable resources and tips. We post regularly on social media. We do blog posting. So yeah, that's a piece that I probably did not anticipate the time investment and the expense and the importance of, to be at the forefront of people's mind as time goes on. Because even though we have enough referrals for therapy, we want our groups to be full. Or if one of our clinicians is offering a training, we want to make sure that enough providers are coming in, and those marketing efforts are invaluable with that.
Right. Yeah. So to take a little bit of a turn here, my practice is also insurance based. So I think that does. The advantage is that you've got a built-in marketing source, and we've really had to put very little effort into marketing our practice.
Yes.
But how was it that you made that decision? Because I think as we hear kind of the buzz in most of the kind of the private practice world is to not be insurance-based, but I'm curious as to how you came to that decision and why you went that way.
It was never a question for me. So the geographic location and the area that I have worked throughout my entire career as a social worker is very disenfranchised. And I knew that if I did not offer insurance, we would be missing a significant portion of the population that is really in need of services. And so it was important to me, and part of my mission, that not only are we providing a safe, compassionate place to heal, but that it's accessible and it's affordable. So what we've done is gotten creative with some of our other offerings. And so I am trained in forensic mental health. So divorce mediation, parenting coordination, guardian ad litem, or parenting evaluations. And so that's been a service that I've been able to offer. The groups. So we do provide some that are obviously for people that have a diagnosis and are looking for support with their mental health, but then others are just strictly support groups, or we've done workshops, or we provide trainings. And so we've tried to get creative with ways that we can offset some of that, because as you know, insurance companies pay what they pay, and we are contracted at that rate, and the increases are not consistent. And a lot of my rate negotiation requests have been denied. And I don't want the clinicians to have to be at the mercy of that completely. And so we've gotten creative.
Yeah. I love that, because I think that's been true for my practice as well. It's just really looking at the number. Really, it's in a way, it's looking at the numbers in a different way. Yeah,
absolutely.
And the truth of the matter is, when I switched from contractors to, having employees, I became much more profitable, even with the lower insurance rates and that sort of thing.
Yes.
So, yeah.
So I think that's helpful for people to hear, because someone can tell you, but if they haven't actually come out on the other side and have the numbers to back that up, it can be hard to make that jump.
Right. Yeah. And I think it's you. And like you said, too, I think that decision a lot depends on the demographics of your area to some degree. I think it also depends on kind of your own personal convictions about offering to use insurance, for clients to use insurance. And all of those things play a factor in that. But I think one message I'd want the audience to know is that if you're insurance based, it is very doable and it is profitable. So, yeah.
Yes. And I will also say on the other end that in my consulting work, I have found myself really working with my clients to determine their value system and what is the motivation driving whatever their inclination is to be insurance based or private pay, and really acknowledging that you can make one choice and that can change. You can opt to be on insurance panels, but be selective. There are so many opportunities now where cost doesn't have to be a hindrance. And if you are private pay and you do the math correctly, you can still offer reduced rate. You can provide super bills. There is Reimbursify. There's Mintea. So there, you can go either way. I think it really has to start with what's your value system? What type of practice and population do you want to serve? How important is accessibility? And you still can find ways to creatively do that if you're private pay. So my mind has been opened for sure.
Yes. Right. Yeah. And I would agree with every bit of that, because I think that's, there's a little bit of a bias, at least in private practice, towards being solely private pay. And it is simpler, but I think
you can avoid a lot of headaches, but I am agreeing with you here to say there are things that you can be doing at the outset and throughout that make insurance much less of a barrier.
Right. Yeah, absolutely. Well, Julia, I've got to be respectful of your time. What sort of parting thoughts do you have for folks?
So one thing that I would love to offer that's free and available on my website, and I'm happy to share the link, is 2 quizzes that I created. So if someone is listening and they're considering starting a private practice, but the idea overwhelms them and they'd like to gauge where they're at in terms of assessing their readiness, that is one. And then the other is, are you ready to expand to group practice and develop a team? And so I really took all the steps that I went through, considerations, pros and cons, and then coupled that with my consulting. And I actually have all of my new consultees do that survey, because it's such great information to have to really hone in and focus on what would be the most valuable things to pay attention to throughout our process. So,
right. Yeah. And how can folks get in touch with you?
Compassionate Consulting Company is the consulting business. And so it's just Compassionate. The counseling practice is Compassionate Counseling Company. And we are on all of social media, and the links are on those pages. And I'd love if people would give a listen to the Compassionate Climb. I'm really proud of it. And the conversations are exactly what I was looking for. I wanted to find like-minded people that share some of my values, compassion, integrity, and be able to talk about some of the challenging aspects of business, but maintain hope and optimism, and we can balance out those values and still be successful. So
yeah, absolutely. Absolutely. Well, Julia, I'm glad you are on the show here, and we'll have links in the show notes and the show summary for folks to connect with you easily. And thanks again for being here.
Thanks for having me, Gordon. I appreciate you and all you do.
Well, again, a big thanks to Julia for being on the podcast. She's one of my favorite people, and I've really enjoyed our conversation. As you can tell, she's really very passionate about what she does. And I think this is, if you've got a staff or a team, particularly if you've got a group practice, I hope you learned a few things or maybe thought about a few things. So I think it's always helpful to think about what it is that motivates people and how you can build an effective and sustainable team. I know I'm very grateful to my staff for the support they're giving me, but also just that it makes my practice run so well by having just the right people. And also be sure and check out Julia's podcast, Compassionate Climb. And learn more about her and what she does. And you'll find links here in the show notes and the show summary, as we mentioned already. And also be sure and check out her freebies that she mentioned. And also, before we get to the end here, I'd love for you to check out JotForm. And if you'll go to practiceoftherapy.com/JotForm to learn about that particular platform where you can create most any form imaginable, and put it on your website or send people things to sign, that sort of thing. And it integrates with so many things like Google Workspace. And that's really how I learned about JotForm to begin with, is just working with people around Google Workspace and people looking for solutions of creating customized forms. So check it out, practiceoftherapy.com/JotForm. And also, I failed to mention at the beginning about the Instagram templates that my assistant Rachel has put together, and you can get to them by going to practiceoftherapy.com/Insta templates and check that out. And those are some templates that you can use to do your Instagram posts, and you use Canva to customize them and add your logo, that sort of thing. So be sure and check them out. And big thanks to our sponsor of the podcast, Therapy Notes. They're the leading electronic health record system for mental health providers. They are who I use in my practice. Couldn't do without them, and I'm really pleased with it, and don't see myself ever changing. So check them out by going to practiceoftherapy.com/therapy notes, and be sure and use the promo code Gordon, just GORDON, to try them out for 2 months for free. And so that wraps up another episode of the Practice of Therapy podcast. Be sure to take time to follow us or subscribe to the podcast wherever you listen to your podcasts. Take care, folks, and we'll be with you next week. You've been listening to the Practice of Therapy podcast with Gordon Brewer, part of the Psychcraft network of podcasts. You can find out more about the other great podcasts in the network by visiting psychcraftnetwork.com. And if you haven't done so already, please visit us at practiceoftherapy.com and get your free private practice startup guide, along with a lot of other great resources and webinars and free things just by visiting. Also, be sure to follow us wherever you might be listening to your podcasts. This podcast is intended to be educational in purpose and is not intended to give legal, accounting, or counseling advice. If you need a professional, find the right person for that.